All right, welcome everyone. Thank you for joining us today. My name is Dr. Jeannie Hannon. I am the Director of Programs for Time to Heal Cancer Foundation. We are so excited today that you are joining us for breast implant illness, what you need to know. I am really excited about this topic, and I am so honored that Dr. Sood and Laura have agreed to join us and share their expertise. Dr. Sood is an American Board of Plastic Surgeons certified plastic surgeon with over 12 years of experience. He now specializes in breast implant removal. Dr. Sood has dedicated his practice to helping those who are suffering from breast implant illness symptoms. And Laura Bowden is a patient advocate for the Breast Implant Illness Centers of Excellence. As a breast implant illness survivor, she offers exceptional support and sincere care, to patients. Laura's story has spearheaded patient advocacy for breast implant illness for over 3 decades. Dr. Sood and Laura, thank you so much for joining us. And I'm going to turn the speaker over to you. Oops.
Oh,
Dr.
there
Sood?
we go. Yeah. Thank you, Jeannie, so much for the nice introduction. And thank you for letting us talk about a cause that's very dear to our heart. It's what we dedicate our lives to. Laura's been not only a survivor, but she's been an advocate for decades. I myself, trained plastic surgeon, was not trained in any of this. And we will kind of get to, what this illness is, how I came to start treating it, how it's at the forefront of everything I do now, and I dedicate all my time towards it. But we will get into a lot of these things. And a couple questions. I see some familiar faces and names in our patient or our client list here, people that are watching us on the webinar. So I know some patients are, will be happy to chime in. They probably have some great questions as well and can probably answer a lot of questions. Next slide, Jeannie.
And Jeannie, as well, I want to thank you for, reaching out to us. I know it was important to you that we get this information out there and, directly reaching out and asking if Dr. Sood and I would do this. So we appreciate giving us this opportunity.
So first question, and obviously we're not expecting answers or hands to be held up here, but we generally will ask, like, who's even heard of breast implant illness? This is a disease process that's not well understood. And Jeannie, you can go to the next slide here. So this breast implant illness, BII for short, it's not well understood. We considered it a diagnosis of exclusion. The FDA in the US essentially, makes it very generic and uses the term synonymously with systemic symptoms due to implants. There is research going on in the space, regarding the symptoms and the etiology, the origins, but funding is a big issue because this is not this is anti-pharmaceutical, if anything. So it's been a tricky thing for us to say, hey, here's all the evidence. We have evidence, we have studies, but they are in certain areas and certain disciplines. There's rheumatologists that have done studies. There's surgeons that have done studies. We're doing clinical studies. So there's a lot going on, but the space is still not well understood. But I can tell you anecdotally, and I say anecdotally because I don't have anything published as far as my patient population just yet, but we have, I don't want to say the word 100%, but we have significant relief of issues. And these issues are generally related to chronic inflammation and chronic autoimmune conditions that are caused by a foreign body that is unnatural, that is plastic, that contains toxins, and that harbors pathogens. So I'm going to let Laura chime in just a little bit here.
Yeah, I mean, BII definitely does not discriminate. This is and I know Dr. Sood will touch on this. These are some of our saddest cases. These are breast cancer survivors reaching out to us that are now suffering from BII and not knowing why. So it is definitely systemic, and we'll have what those symptoms are on another slide. So we'll touch on that a little bit further. But we definitely need continuing research. Research has been there for decades. It's just been very well hidden until now.
And one last thing I wanted to go talk about before the next slide is the breast cancer patient population that we are dealing with more and more. It's been very interesting for us because I've been doing this almost 5 years exclusively for, in general, removing implants in the capsular tissue, which we'll get to. But then we started taking on patients that have been through mastectomies and radiation and chemotherapy, and even if they're prophylactic mastectomy, and then they've been through maybe one or two surgeries with an implant-based reconstruction, and then they realize that they have systemic symptoms that may be correlated with implant illness, but there's no exact test to tell us that. So then they go through a subsequent surgery, might be their third or fourth at that point in time, and then they're left with very few options for reconstruction, which I will talk about as well. So this has been some of our saddest cases because we know we're putting patients through an additional surgery after they were maybe not misinformed, but not informed about the reality of these devices that are not lifetime devices. They are not inert, and we'll talk a little bit more about that if we can get to the next slide, Jeannie. So the history, and I'm going to let Laura get to this because I'm 30 years young here. Laura's going to be able to. I'm not 30, but Laura's been around, and her story is actually in this timeline here. So I'm going to let Laura tackle this.
Perfect. Thank you, Dr. Sood. So we're going to look at the history of breast implants and how have we gotten to where we're talking about this today. So back as we follow it from 1976 to 1986, there was a woman named Mariana Hopkins that had Dow Corning breast implants. She became very, very ill. She went to sue Dow Corning. Dow Corning was going to settle with her, but this brave woman would only settle if the gag order was lifted. And what did that mean? It needed to expose the internal documents that Dow Corning had showing the dangers of breast implants. And the gag order was lifted. And it went to the FDA commissioner named David Kessler, and there was a moratorium, and they were taken off the market. Unfortunately, they were put back in the market in 2006 with no new safety study, no new and approved breast implant, really at a very powerful industry fighting. Obviously, there were some financial reasons, the reason they were fighting to put them back on the market. I became sick from my implants in 1992, from 90 to 92, had them removed in 1992. I got my life back and became a voice. And I thought it was important that women are given informed consent, so they can make the best informed choice that they could. And then in 2018, I went to a meeting where there was a documentary on women that were very sick. Dr. Pryor, who's the founder of Pryor Health, was at that meeting and realized that women have been sick for decades. And then we speed up forward. I ended up joining with Dr. Pryor and then a little bit later with Dr. Sood to, help educate these women and the women that were sick to do the proper explant. So this is pretty much where I'm at now with Dr. Sood. And, he's pretty much taken the practice by storm and pretty much based on his patient experiences, his compassion is like something I've never seen in this community. And he has a gift to do this surgery, as many of his patients can attest. So like Dr. Sood said, our saddest cases are our breast cancer survivors. By the time they find us, they have done better research in the FBI. So it really is our pleasure to help this community. So that's the history. It's been around for a long time. There's so many women are like, I didn't know this is a thing. It's a thing, and we've been fighting for decades.
What we're missing in this history is there was a point in time where silicone implants were taken off the market and saline implants were thought of as the safe alternative. And those were essentially taken off the market. And this was more than a decade ago due to silicone toxicity and evidence that there was issues with those implants. And then it was quickly remanufactured, made into a better shell or gel, and these still continue to be improved. I use quotes every couple of years. There's something new on the market that's improved, but what we've been noting is with each subsequent improvement in quotes, patients are actually getting sicker quicker. And it has a lot to do with the durability and what they're putting in these materials to make them more durable. But what we know as as a surgeon and Laura as an advocate and survivor, it's not about the actual spillage of contents necessarily. It's more about what is this device leaking over time. So not only does the implant cause problems, a rupture will sometimes propagate the problems because there's a leak outside of the scar tissue, which maybe I'm jumping ahead here, but there's always been a problem, and it's been buried multiple times over, and there's been multiple surgeons speaking out over decades, even in the 80s, and they've been quieted. So this is something that my moral compass 5 years ago had shifted, and I learned about this, and once I knew I couldn't go back. So if you can go to the next slide, Jeannie.
And thank you for that, Dr. Sood. You just touched on something. All breast implants gel bleed, all of them. So a woman doesn't, just like he said, a woman doesn't have to have a rupture to get sick.
So this is just a slide about me. I guess I'll go quickly over this. So I've been doing plastic surgery for 12 years. We don't learn about breast implant illness. We don't even learn about explant surgery in training. So generally, it's a very difficult procedure to properly remove the implant with the scar tissue. And the Society for Plastic Surgery generally states that they don't think it's safe for everyone to be doing the surgery. And they essentially don't want people doing it because it's could be potentially dangerous with the surgical technique that's involved, as well as will create a negative stigma towards implants, which is a large part of the plastic surgery population. I've been working with Laura over almost 5 years now, and we are trying our best. We're first of all, we're doing a lot of surgery. We're treating a lot of patients, but we're trying our best to have talks like this, do podcasts, just create awareness, because that's our number one goal, is to spread awareness that this can happen. It does happen. And unless you're looking for it, unfortunately, you can't just find this information. So go to the next slide, Jeannie.
So this is a little bit, of course I could go on and on about this. um, So a little bit about my journey. I was sick in 1990, found out just my God-given gut. People say, how did you know? This is before social media. When it really comes down to it, it was my God-given gut. I was very healthy and literally taken to my knees within 2 years. So I found out about a neurologist in Texas that was doing a study on what used to be called silicone adjuvant breast disease. So BII has changed names probably 4 or 5 times through the decades. Was part of his study. I met 3 floors of sick women just like me when I thought I was the only one. Only by the grace of God, this neurologist had a surgeon at the hospital that knew how to do an end block. What is an end block? I didn't even know what an end block was. And we'll go into that a little bit further down. That scar capsule that's around the implant, it's very important that that is removed. And again, it was removed in my case. In my case, within 24 hours, it was like somebody flipped a switch. I became very passionate once I realized that this was a thing. And it was like taking the logs off the fire for me. And this is where I came back, my 28-year-old young self. And it was my mission to spread awareness and any platform that would have me. My husband and I started a support group in Illinois, and we put a little ad in the newspaper, and women came from underground. And that was really the making of this movement for me and my calling and the Oprah, and we'll go down into the Oprah video. But so I was blessed to be on Oprah twice, Jenny Jones, Good Morning America, anybody that would listen in the media, because we didn't have social media. So it's been something that's been really important to me to spread awareness. I truly believe that this has been my calling. Also had the pleasure to speak at the FDA in 2019 on the lack of safety of breast implants. If anybody would like to watch the whole YouTube video, they're welcome to go to YouTube and look up Laura Bowden on Oprah. And it gives you a 7-minute clip of a little bit about my journey and, some other incredible advocates that have been fighting for informed consent for decades.
And this has gained some media attention over the years with some celebrities that have come out, or people that are known names. One of the popular ones was Danica Patrick, with the female race car driver. So she was one of the first public figures that had kind of come out. It's been a while now, more than a decade ago. More recently, Alyssa Milano, actress, has come out about her implants making her sick. Connie Chung, I believe, the reporter. Laura, is that correct?
I'm actually Connie Chung. Thank you for asking. Connie Chung actually reported it back in the 90s.
She
She
reported
wasn't,
it. Okay.
but she's the first one that really brought it to media. And funny story about that. So before, when I had just got my implants, I was in my kitchen and Connie Chung came on talking about women being sick from their implants. And I remember walking out of the kitchen because I thought, ah, that's nonsense. I remember it like it was yesterday. So, I think there's a lot of denial. I didn't want to believe. So we can kind of get into that. But thank you for mentioning Connie Chung. So it was more, she brought it to the forefront in the 90s.
Jeannie, go to the next slide here. So a lot of our patients or clients here, they've had breast cancer or, are going through the motions of potential mastectomy and lumpectomy. And, you are getting options of reconstruction. So what do you do now? You can go to the next slide, Jeannie. So we know there's a significant amount of the population that gets breast cancer in the US, and this is according to data. A lot of the women with breast cancer will receive a single or double mastectomy. And not only is it traumatic, it creates a sense of losing your womanhood, self of sense, or loss of sense of self and beauty. So all of the breasts for women are considered um, a part of womanhood, and it's really difficult for women to go through this, and we understand that. um, the options that are provided are generally autologous, which is using your own tissue, which not every patient can have that ability or that type of surgery after a mastectomy. And then the other option that's presented is the implant-based reconstruction, which is also touted as the easier surgery, the one that's less traumatic to your body. And most patients actually are generally guided towards this direction of the implant-based reconstruction based on the surgeon availability and what they can provide. So next slide here. So what do we know about breast implants? We know that they've never been proven 100% safe. What we also know, and this is it's very important to me, is it's not the type of implant. It's saline implants, believe it or not, the ones that are filled with water. Those women actually have even worse symptoms than the patients with silicone implants, and slightly different symptoms as well. But their severity is worse, their detoxification is longer, and we'll get to a little bit more about that. The whole process, it's an immune response. So it's your body goes into overdrive, fight or flight. It is essentially looking at the implant as a foreign body, which it is. It kind of creates an autoimmune reaction, which therefore leads to a chronic inflammatory condition. This chronic inflammatory condition affects all portions of the body, all the joints, all the cells, and a lot of the symptoms, which we'll talk about soon, are all triggered by inflammation at its core. So it's autoimmune and inflammation. There's two key points here. So if you just because you have breast cancer and you've had your breast tissue removed, you're not necessarily immune from any of these things. So the breast tissue does not seem to have any factor in causing breast implant illness. So it seems to be purely related to the foreign body.
Okay.
Next slide, Jeannie.
Mm.
So here's just you'll see a couple of pictures here on the left side of just different types of implants. There's the silicone implants and saline. These are the two major categories. The term gummy bear had come out roughly like just under a decade ago. And essentially what gummy bear meant was they made the gel more cohesive. So the gel inside the shell, they essentially made it thicker so that it had a drawing force to kind of stick to itself and not just ooze like liquid out into the body. So it does on, when a lot of people have seen these ads or these surgeons just cutting the implant and showing, oh, look, you push it, but then when you let go, it kind of goes back in. That might be true, but is that preventing any micro leak or any essentially any of these components that are on the right side of this slide here from getting into your body? They're not. All it's doing is just making it thicker. It's like a thicker pudding, essentially.
To add on the gummy bear, we have a patient that calls and they tell me that they have symptoms of BII. When they say to me, I've had my implants for 2 years, I immediately ask if they have gummy bear and they say yes. My personal experience with phone calls of women that we've had coming in every day is that these gummy bear implants are the most toxic implants we're yet to see. And they are now being touted as the safe, new and improved implant. So it's important to mention that. And then when we are looking at these ingredients, I mean, that pretty much to me speaks volumes. I mean, to have these kind of ingredients sitting at our most vital organs, our lungs and our heart, obviously there's going to be an issue.
Yeah, and we our the breast cancer patients that undergo reconstruction generally get the highly cohesive implants because they have a lack of breast tissue. So they're more on the gummy bear side of things. Most surgeons are using these very thick gelled implants so they can hold their shape and hold their position. Um, and or look at this list of metals. So whose body can detoxify or remove all these metals without help? So there comes a point where these chemicals and metals that your body hits a tipping point of like, I can't handle this detox anymore. Every body has a capability of detoxifying elements from our environment and our diet and things like that. A lot of it is genetic. We know that our liver helps to detoxify, and there's other components of our body that are helping to detoxify our general daily living. But plastic in general, we always talk about microplastics in the media and plastic bottles and plastic straws, and they're bad for everything. And the analogy I always use is, if you have a water bottle that's sitting in your car, it's 100 degrees out, that water's just been sitting in there. You don't take it in and go cool it off and just drink it, because that water most likely has some microplastics that's been leaked into there. What makes an implant different? This implant's sitting at body temperature plus minus 100 degrees Fahrenheit for years, decades. Actually, I should start at months because we have some patients that get sick very early. So it's sitting there just brewing and releasing. So what makes that so different? And we can go to the next slide. Symptoms. Laura, you want to attack this one?
Yeah, and the next slide is really a little bit more specific on symptoms.
Yeah.
These are photos of the eyes. It's really hard to explain unless you've actually continued to see it. I always say, the eyes are the window to the soul. And these symptoms of BII, in my belief of everything that I know, cause inflammation in the brain, and it starts from the brain down. We can see BII in women's eyes. They're dry. They're bloodshot, and again, without saying there's a crystal ball, we see sometimes in 24 hours that the whites of their eyes change. They're no longer dry. It's like taking logs off the fire. When we take these objects with the capsules, these foreign objects out, the body's able to settle down. So we can go to the next slide.
So here's a more complete list of things that are and have been correlated with systemic illness from these foreign objects. Physically, those are the ones that generally those are the easiest ones for us to kind of talk to patients about, and that's joint pains and hair loss and brain fog and word retrieval issues and just overall weakness, difficulty sleeping. And then there's more specific things. We have patients with ear ringing, with issues with their inner ear, and they go to multiple doctors and they look at everything and everything looks just fine. So they kind of go on with this ear ringing. A lot of patients have dry eye. They're diagnosed with an autoimmune condition, Sjogren's syndrome, which is all the way to the right of this slide. People are falsely diagnosed with multiple autoimmune conditions based on false elevation. Actually, it's a true elevation of markers, but it's very non-specific, a lot of these things. We see a lot of thyroid disease, hypothyroid specifically, which has an autoimmune component in a lot of patients. We see a lot of lupus patients that are miraculously don't have lupus after a month after removal. Fibromyalgia is unfortunately very common because it's also a diagnosis of exclusion that patients are given. Raynaud's, Lyme's disease. Every day, almost 3/4 of our patients have one of these conditions diagnosed or mentioned by one of their doctors in their lifetime, and they don't know what to do. And then eventually they figure out that it could be correlated with this, with deep diving into research. And we've seen all of these things cured, especially if they're, not present prior to getting implants.
It's important to mention also that, a lot of these things depends on how long you've had your implants. The physical, the shoulder pain, I would say probably 100% of our patients have complained of some kind of structural pain. As far as neurological, our top, just like Dr. Sood had talked about, ringing in the ears, we see that probably more with our saline patients and our silicone patients. But the fatigue, and it's a type of fatigue, unless you've been through it, that you can't really explain. And I think it's really difficult to come to terms that possibly this is what's going on for our women that are in their 40s or 50s. Is it perimenopause? Is it menopause? And I do feel so bad because I think they suffer a lot longer because they're in that age, and they're like, oh, could it be? Could it not be? Again, there's no crystal ball, but just like Dr. Sood said, it's diagnosis of exclusion. We watch these women get better. Now, at what rate, right? Absolutely 100% women are thrilled that they did this, but sometimes their journey is just a little bit longer depending on their detox
You know,
processes they have to do.
Laura, one thing that you've probably heard me talking about more is like the mechanical issues
Hmm.
rather than just what we're seeing here. So the way implants are placed into the body, in general, it's like 75, 25%, but a lot of doctors will place them under the muscle of the chest. So that pectoralis major muscle, which is a very large muscle group and part of the larger muscle group of the upper body, is lifted, and one of its attachments is completely removed. So that muscle, that large muscle, is floating on top of the implant for coverage. So it's done for a reason, and it kind of makes sense if you think about like what the doctor's thinking. It's trying to provide coverage, so it's not just skin sitting on an implant. What that does is it kind of throws all the muscles out of whack of the upper extremity. So everything likes to work in groups. So the pectoralis muscle likes to work with the trap muscles and the deltoid and the arm muscles. And the pectoralis muscle is actually attached to the arm, the upper part of the humerus. You take that muscle out of whack, and patients are getting arm pain, shoulder pain, upper neck pain. A lot of patients are diagnosed with bulging disc at some point after having implants. They're hunched over. They go through shoulder surgeries, not only from joint destruction, but from inability to use their joints. So
Hmm.
we're noticing a lot of those things as well. And also we'll have some pictures of this, but the scar tissue capsule that forms around implants, imagine where that's sitting. So not only is it on the outer portion of the implant touching, towards the surface, it's also on the rib cage. So by having this layer of scar tissue, which I always I call it a layer of cement, because that's essentially what it is. It's a cement layer that does not allow the lung cavity to expand. So therefore, a lot of our patients can't even take a deep breath for years because their lungs can't expand to the maximal capability. They also get heart flutter because the heart is sitting right behind. They're on the left center of the chest. So a lot of patients get these physical, like true physical mechanical issues with implants that are related to actually the surgical portion and not necessarily the systemic portion. And those sometimes we can pinpoint as that's a problem itself. And these need to be kind of removed to kind of let your body function. And muscle repair is one of the components that I do during the removal. That muscle needs to be put back where God intended it for your body to start functioning again.
Right. Thank you for touching on that, because there's a lot of chatter lately about muscle repair and no muscle repair. 100%, if it's underneath the muscle must be repaired.
And it's technically it's an additional step. And there's doctors that say, oh, it's the muscle's not long enough to repair. It's this and that, and that's fine. But with my technical ability, and I'm sure with their technical ability, it's possible. I repair it on 100% of patients that I go in and into the chest cavity.
Next
Next
slide,
slide. So Jeannie's going to play this video. This is Laura's appearance on Oprah against the Dow Corning
Yeah.
people.
So
Yeah.
I want to touch base just a little bit, just to give a little bit of a segue with this clip. So back in the 90s, when the Oprah show had called and asked if our support group would be in the audience, we did see that the plastic surgeons were on one side with the Why Me Breast Cancer Foundation. And they were really having a hard time with women coming out and giving this information and talking negatively about breast implants. They felt that we were taking the right away to be a woman and to be whole again. And that was never our intention. Our intention is, we felt, as we do, this is 3 decades ago, and here we're having the same conversation, is bringing informed consent. So women that are suffering or have survived breast cancer are able to make the best informed decision that they can. Unfortunately, the women that we are now seeing that are coming to our practice for help are still to this day not given that information. They have been diagnosed with breast cancer, of course, still in shock, is not sure what to do, and immediately they are handed a card to go see a plastic surgeon for reconstruction, which probably 90% it's breast implants, and not one mention of BII. So they're given informed consent. So this is a clip of having our support group on one side and the Why Me with the plastic surgeons on the other side. So go ahead. Thanks, Jeannie.
I wanted to get back to the issue of choice. I think we all have to take a personal responsibility for the decisions we make, no matter if it's a new medication or a medical device.
Let her finish. Let her finish, and then you can
It
speak.
is
Go ahead.
our responsibility to find out as much as we can about it and make the choice based on what we know today. I mean, that's what's all free about this country. And
I know,
who we
but in
are.
1974, we didn't know enough. Would you agree?
Perhaps we didn't, but we did know how long those products were on the market. And again, it was chancy, and people needed to make that personal choice.
I wasn't told it was chancy.
What do you say? What did you say, ma'am? What did you say?
No one gave me their choice for having a mastectomy. They told me it was going to be perfect. I was going to be dead, and those boobs are going to be standing straight up. 5 implants later, they were ruptured. Now you tell me that I don't hurt? Walk in my shoes. You want to study? Study me. Study the women that hurt, nobody else.
Oprah, can I get
It's
into this?
most unfortunate that most women didn't feel they were informed. But we run a national hotline. I'm with the Wyoming National Breast Cancer Organization, and it's amazing to me, even today, the number of women who call us and want someone to make the choices for them, that don't ask the questions, that don't want to hear. They want to be able to just go in and say, take care of me. And hey, that's their choice too. If that's the way they want to handle their own personal health and healthcare issues, that's fine. But what we do is we educate women constantly. We've educated in our organization from the very beginning that these devices aren't perfect, but they're what we have today, and it's up to you to sort it out, to go to a doctor. Another thing,
So
many women...
if they're not perfect, Sharon, this is a question I'm posing here. If they're not perfect, and you know that there's some risk, and you put them in your body, and they rupture and seep down through your ribs, is that okay?
I think what you need to do when you make that choice is to continue to remain vigilant. Many women left the doctor and for years never went back to have their implants checked. That's a mistake.
Oprah?
Yeah, we will be right back. You say what? Yes, ma'am?
I live here in Illinois, and I had implants put in 1990. Always a very healthy woman, never a problem. 4 months after, a series of problems started. Within 2 years, I went to every doctor you can imagine. Women, you have to listen. Please. They tell you it's in your head. You begin to think you're crazy. It's very real. It's not an open wound, so you can't see the pain. It is like you're dying from inside out. I've been there. I got them out, and I got better. And I see these women. I've been involved with this group for 3 years, 4 or 5, and I will not stop. You may have the money, but we've got the voices. Live up to your responsibility. These are mothers. We have families to raise. We have to travel out of state to get help. The doctors think you're crazy. You walk in the office, we don't know what's wrong. You go home. If it wasn't for my family, I don't know where I'd be. We refinanced our home. My insurance wouldn't help. I left my children, my 3 young children, for 2 weeks. I got them out, and I dramatically, 70% of the symptoms go away when they're removed. How can you say this is not cause and effect? How can you sit up there? How can you sleep at night? I just don't understand. You're a human being. You're a mother. Nobody wants to be sick. It's not the money. It comes from the heart. Please listen to what we're saying. I'm young. I've been there. Listen to what we're saying. There are, to this day, 72 deaths and 91,000 injured women. And we are too busy fighting this political battle to get the research to help these women. We don't want to be here. We want to be home with our families and taking care of our children. Stop the lies. Be responsible for what you've done. You've got the studies. You know the truth. We don't want to be here. I'd rather be home with my children. But I will never stop talking. I know the truth. I've been there. I know how these women feel. I am one of the lucky ones, and I will talk till I'm dead about this until something changes.
Yeah. Powerful. Laura's got that same passion. She's just a little bit older now, but she's still got the same passion. Jeannie, you can go to the next slide here. Okay, so we're gonna get to talking about the actual surgical portion of this, and there's some terms out there. There's the word en bloc capsulectomy, and there's total capsulectomy, and there's partial capsulectomy. In general, the capsule is a scar tissue layer. It's very vascular, so it has a lot of blood vessels that grow in around it. So that's why things can be extracted from what's within the scar capsule. We have learned, and we know that it's very important to remove the scar capsule, as if it's left in, it's not only potentially, contains the toxins that were from the device that's inside, but also it can also lead to cancer later in the future. A specific type of cancer that's related to capsules, and there's a couple of them. If you can go to the next slide here. So removing the implants with the capsules intact, that's generally what en bloc or total intact capsulectomy means. Intact meaning together. And en bloc is actually a cancer term for cancer surgery. So a lot of medical organizations, don't want this term used for this type of surgery because we're not technically removing a cancer. So total intact is pretty synonymous with an en bloc method of removal. The capsule is a scar tissue. It's a natural response to any foreign object. If you have a splinter in your finger, you will have a capsule around that splinter. If you have a hair that gets ingrown, it will have some scar tissue that forms around this area. So it's important to remove this scar tissue as well. And if you go to the next slide. Ooh, okay. So those are some ruptured implants and silicone implants that were removed, and you can see the scar capsule sitting in front of me. There's some thin areas. You can see right through them to the blue towel, and some of them are thicker areas. The thicker areas are generally tissue that's been damaged. So most of the time that in patients that don't have so much diseased tissue around the capsule, I'll remove them very thin. And we'll see in our next slide here, actually, Jeannie, that this is a general way that most of our en blocs look. We see these little thin, wispy layers. You can kind of see through them. And then we see a couple areas of whitish or extra scar tissue. Sometimes we see calcium buildup that feels like bone. But in general, this is the standard way to remove these. So this would be considered a total intact or en bloc method of removal. The full egg shell is removed with the egg. Next slide. So this is saline implants that are, what we're showing what's underneath. Most of the time we see what appears to be a normal appearing device inside the capsules. And what we're seeing here is the saline implants. We see those little valves that are on the top, and those are how the doctors will fill up the implant. So they actually go in like an empty sac, they attach a little tube to that valve, and they pump the saline into that valve. And then they pull the little straw or tube out, and the valve will self-seal. But what we do know is we've seen multiple times. The reason we're showing this slide is because it's our most common. We don't see too much in there, but we have seen snow globes, we have seen mold, we have seen floaters. All types of pathogens can communicate through these valves. So it is not a closed space. The implants also are porous based on gel bleed, which we have proven time again that if an implant is not broken, but I take it out and I'm touching it, why is there gel in my hand? But when I squeeze it, there's no hole. So we have plenty of examples of that. But generally, this is what we see in the majority of patients, that they look like the day they were put in.
This is a good slide. If you look really close and you see where that valve is, and it's very typical for us to see this, you see mold. See those little dark spots? And that shows that those valves are obviously not completely sealed. So you have bacteria in, bacteria out. These implants sitting in body temperature, just like Dr. Sood had said, is like a petri dish. So many of our saline patients, like we had talked about before, have more systemic. But if you look close, it's very unusual for us not to see that little mold where that valve site is. But like Dr. Sood said, majority, they look like the day they were put in.
Sometimes we can't see with our eye some of these pathogens that are in there. You can't always see bacteria. You can't always see viruses. Mold generally will show itself at some point, one way or another. Next slide, Jeannie. So another total intact or en bloc removal. And then you can go to the next slide, Jeannie.
And this is a silicone.
Yep. And we'll see in the next slide. So these are silicone implants. They might look a little bit more yellow or cloudy than when they were fresh and put into the body. But this is the general appearance of implants that have been in there several years. And they look like they're overall in pretty good shape. You could probably resell them, but I highly advise against that.
And this is where when you touch that, you can feel the outside. You can feel the slime on the outside of these implants. Next slide.
So this is pretty much a photo in real time showing once I open the capsule, and we do these little capsule cutting. I don't like the word ceremony because ceremony usually implies something good is happening, but capsule cutting on the side table after the patient's closed up. And when we open the capsule, sometimes we find goop inside. And this is probably one of the older, I would say this is probably 2 to 3 decades old of type of implant based on the gel that I'm seeing here. Completely destroyed implant. The capsule, which is the shell that's supposed to be holding it, it's somewhere floating in there. So imagine if this was not removed in this method of en bloc or total intact, imagine that gel hitting your tissues, and essentially you're getting a super boost of this negative components of these implants.
It's, oh, I'm sorry. Go ahead.
No, go ahead, Laura. Go ahead. I was pausing. Go ahead.
That's okay. I want to make sure that we mention and touch, and this is a great screen to do this, that we are finding, I am not anti-imaging at all, but we are finding that mammograms are actually rupturing implants. And when we see a severe rupture, even like this, even though, again, no crystal ball, we can't prove that the mammogram did it, but we are continuing to see over and over that mammograms are rupturing implants. The patients know when it happened, or just by the break, it kind of is more suspicious that a mammogram did do that. So just something to put in the back pocket as far as getting any kind of imaging.
Yeah, mammograms are always the first line of defense for the insurance to then, potentially order the more expensive or labor-intensive study like the ultrasound or MRI. Ideally, we would never do mammograms. Ideally, we would have some sort of thermal imaging that could be read by a professional, or ultrasound everybody. But it's very expensive for the insurance companies, and I equate insurance companies to the pharmaceutical companies. In my mind, they are both live on one side of my brain. But let's go to the next slide. So this is a video. This is one of our lovely patients, and I think we have a couple of them, but you could hit play here, Jeannie.
So we're sitting here with Lori today, and she is at her one-day post-op. She had a aesthetic flat closure by Dr. Sood. She is 65 years young, and she's got a story. So kind of tell us what your journey's been like, Lori.
Sure, I'll be happy to. I discovered my own lump in my breast early 2012. Took action right away. Had invasive ductal carcinoma, and opted for what I thought was the best treatment to remove the cancer from my body, and that was bilateral mastectomies. It was a very rushed period of time. You go from a surgeon to a plastic surgeon all within hours, and these folks just carried me through some decisions that if I had to make those same decisions again now, I would not make them. But I had bilateral mastectomies, tissue expanders for about 6 months. Those expanders were removed and implants placed. And I honestly felt okay with those implants. I had a lot of function. It decreased my function, decreased my ability to lift. I'm an active person. I couldn't do a push-up. I feel like just my range of motion for the most part was severely affected by those implants. And if I have to really think back, I believe that's where a lot of my aches and pains with my joints started. Fast forward to about 2 years ago, I was picking up a heavy object, and my initial implants from 2012 dropped and needed to be repaired. So I found a plastic surgeon who took my prior implants out. They were under the muscle, and then changed the plane, I believe they call it, and put them on top of my muscle. And within 2 months after that surgery, I knew something drastically was wrong with me, and changes were drastically happened that I could only isolate. Nothing in my life had changed except I had had those implants put in and the others taken out. And I had multiple visits to my primary care manager, multiple lab results done. Everything would turn out normal, but yet I felt horrible.
What symptoms were you having?
I was having joint aches all over, dry mouth, which I still have a little bit right now, and brain fog, tremendous brain fog. And I'm a retired military, Navy nurse. I could multitask with the best of them, but I felt like I couldn't stay focused on any one thing. as his brain fog started. And what else did I have? Heart palpitations, panic. I just felt like I was having panic attacks, and I am not one to ever have that either. And so I just began to research what's wrong with me. And I started digging, and I found these support groups on Facebook. And the one I found the most informative and supportive was the one that you, Laura, started. And when I would read other ladies' stories, I felt like I had found answers, and others were feeling like I was. And one thing led to another. To me, it was divine intervention that I wound up here. I'm a highly intuitive person, and I just knew this is where I needed to come. Day one post-op, I feel fantastic. Very little pain. I had a flat closure. I'm happy with how that looks. And I was sharing with Laura, probably another turning point for me was this. I'm a person who seeks peace, thrives on peace, not chaos, not drama. But I found myself about 2 weeks ago feeling so panicky and anxiety ridden. I could not get, it's like my body was possessed by something. And it was at that point, I didn't want to take phone calls from my kids. They're always checking on me. I just didn't want to talk to anyone. I just really wished to just go away. And if this was gonna be how I would feel for the rest of my life, then I just didn't want to live it. I was gonna choose differently. But thank goodness, with support from friends and family, I got through that day and just focused on September 3rd, September 3rd, September 3rd. And there's a new chapter now. Laurie's back.
Yeah, Laurie's back.
Yeah.
Yeah,
And
well, I want to thank you for your vulnerability. I know you are a strong woman, and to get to the point, and I've said it before, that it's like your brain's hijacked. This is not you. You know, you had lost your joy. We're going to follow your journey, and being a breast cancer survivor, now a BII survivor, your message is going to resonate with so many women that feel exactly the same, and it's going to help them realize that they're not alone and they're not crazy, and this is a thing.
This breast implant illness was worse than treating the breast cancer.
Yeah.
Breast cancer was a piece of cake compared to what has happened as a result of the reconstructive surgery. And yeah, so.
Oh, well, it's pretty powerful. That's powerful, so we're going to definitely follow your journey. And I want to thank you for trusting us.
Thank you.
You are so welcome. Thanks, Lori.
Mm-hmm.
So another really powerful video. She was able to kind of talk about the mechanical issues she was mainly focused on initially. And then she had an exchange due to another mechanical issue where the implant had fell. And once that exchange happened, there's only two real possibilities here. Was it because the capsule was open to remove the implant and there was a spillage of contents that made her sick very quick? Was it the new implant that was put in, which was probably newer generation, more cohesive? Probably a combination of these two things. But time and time again, Laura, should we play this one? This is a nurse actually that that
This is
also went through. Yeah, we can play this one, Jeannie.
So we are sitting here with Krista today, and she is at her one-day post-op. She is a breast cancer survivor, and she came here for proper aesthetic closure with Dr. Sood. And she came here all the way from New York.
Yes.
And it's really important. And she's a nurse.
Yes.
So this has been quite a journey for her, and it's very important to her to tell her story to help spread the word. So
Yes.
Krista, tell us your story.
Absolutely. I was diagnosed with breast cancer 5 years ago, and had to have a bilateral or double mastectomy due to the amount of cancer present. And speaking to the plastic surgeon afterwards, I really was just given, kind of one option. We're going to go ahead and do reconstruction with implants. I didn't have any time to research or think about that because we had to move very quickly given the extent of the cancer. So I agreed and had implants placed. I had issues right off the bat, first of all with tissue expander, and then once the implants were placed, it was never right. I never, it didn't feel right. It was just, but I thought just recovering and, let's just wait it out and see how it goes. I would say within months to a year, I knew that something was wrong. I began with brain fog, difficulty concentrating, pain and aching in my chest, really feeling like it was hard, like I was breathing against a sandbag on my chest, and it never felt the way I thought it should feel. I then developed some crazy neurological symptoms that the best neurologist in my town did not have an answer for. And so I began researching myself and found that many of these neurological symptoms are present in women with BII. So I joined this Facebook support group and very quickly learned that that was the culprit and that was my problem. I only consulted with one physician because I knew after I spoke with Dr. Sue that he was the one, and Laura is an angel, and so this was the place for me to be. Things went so smoothly from start to finish, and it was the best experience. And I worried a lot about having a third surgery now after mastectomy, reconstruction, and now this. I really did not want to put myself through another surgery. I worry about risks, and I was just concerned, but I just decided that living the rest of my life that way was not an option. So I had no energy to play with the kids, to enjoy my life, and so I knew I had to do something. As soon as I got here yesterday, I knew that these were my people, and things were gonna go so smoothly. They took care of everything. So if you were on the fence at all, this surgery was absolutely 110% worth it. I woke up out of anesthesia and took a deep breath, and it was the first time I could take a deep breath like that in 5 years. So I feel better. I didn't wake up with the bags under my eyes that I always have. I feel fantastic. So Dr. Sue saved my life yesterday. He really did. I was trapped in my own body, and it was really debilitating. So I feel like a new woman. Like I said, the surgery couldn't have gone any better, and they treat you like family here. So you are a family member, and they will go above and beyond. So if you had any question about whether or not to do it and which physician to use, Dr. Sue and Laura are your team, and they're phenomenal. So
thank you.
Grateful.
And you were able to take a look today.
Oh, I must brag. I must brag about Dr. Sue. We did an aesthetic flat closure, which I've seen pictures of, and it can, you know, it can go a couple different ways. It's not always, you know, it's a tough thing to do. I looked in the mirror and it is unbelievable. Just the smoothest looking from chest all the way to under the axillary area, under your armpits. The smoothest closure. It is. I still don't believe it. It is unreal. He did an amazing job. So can't recommend it enough.
Well, I want to thank you for trusting us and traveling all the way from New York.
Absolutely.
And being a nurse.
Yes.
I mean, that's being, you know, you do better research than the FBI.
I did my homework. Yes,
you
ma'am.
did your homework.
I did.
So we're going to follow your journey.
Yes.
I figured we'd seize the moment before you went back to New York.
Love
and I want to thank you, for sharing your story. You know, sadly, we continue to have breast cancer survivors that are now BII.
Absolutely.
And they're some of our saddest cases.
Absolutely.
So we need to continue to spread awareness within that community.
Definitely.
Definitely. To help these women that may be sick
Absolutely.
and don't know it, or to help them make a better informed decision as to what is going into their bodies, because that is not happening in that community.
It didn't to me. And it's we can do better. We need to do better as healthcare providers. You really need to explain all the risks. Had I known that it was possible to develop a different cancer because of the implants, or that BII was even an option, I would have declined the implants. So we'll continue with our advocacy. Laura has my name and my contact information. If you have any questions, concerns, want to know about my experience, or anything I can help you with, I'm so happy to.
Well, welcome for joining the front line.
Yes, I am a member.
So let's get you healed.
In the front line.
And you are going to be a voice.
You got
it. And welcome to a club that we never signed up for.
Absolutely.
But,
absolutely.
What a beautiful, supportive group of women we are.
Oh, unbelievable.
So, I want to thank you. And we'll definitely have this conversation again.
Absolutely. Absolutely. Thank you.
So Jeannie, go to the next slide. We're going to skip over this one. We just witnessed like just two of our patients. We're going to unfortunately have to skip over the third due to timing, but I'm going to talk about the aesthetic flat closure, what these two patients alluded to. So in general, patients that don't have much tissue to start with, and they can't undergo autologous reconstruction, this is what an aesthetic flat closure looks like. It's essentially making things as flat as possible, leaving no extra tissue in the axilla. And it's mainly a comfort thing. Not only does it look symmetric in the mirror, but it allows you to wear those breast prosthetics or bras or bands slightly more comfortably than having extra skin hanging there. So this is just an example of a thinner patient that had undergone what we call AFC, aesthetic flat closure. Probably looks a little bit better than a standard mastectomy because of the way we kind of go about it.
Important is she's pretty early on, so those scars are going to continue to heal. I want to make sure to mention that.
Yeah, this is about 3 weeks, so we expect these to be pretty good later. The next slide, Jeannie. So this is fat transfer. It's not always an option. It's actually very seldom an option for our breast cancer patients. In order to put fat into tissue, the tissue needs to have a certain thickness. And the only tissue we're dealing with on the breast cancer patients is really the subcutaneous fatty layer tissue. So when mastectomies are done, on some patients that have that tissue, we can potentially do a little bit more fat into there. Sometimes we can actually just reshape the remaining tissues if they have enough bulk of fatty tissue to make them look like a breast, and then they can get nipples tattooed. So this is seldom an opportunity for our patients, but it is possible in some. Next slide. So we're going to talk a little bit about just some research articles. Laura, you want to get into this one real quick?
Yeah, I'm going to touch on this one real quick. This by Bernard Patton. This was the study that I was involved in back in the 90s. So it would be interesting for women to go. It was silicone adjuvant breast disease. There were 100 of us in the study. So when they say there are no studies, there are. They were very well hidden. It's important to mention too that my neurologist, while doing this study, somebody broke into his office, put duct tape and crutches on his desk, and they destroyed his career. over 3 decades ago. So that speaks volumes.
Next slide.
That's pretty much self-explanatory.
So nothing is proving that these devices are safe. Everything is, all the studies out there are proving that it's an option. Next slide. Okay,
Yes.
so
Yes.
the FDA had reports of cancer issues within the capsular space, so between the implant and the capsule. And this was studied, and there was 2 specific cancers that were noted, and it was squamous cell carcinoma, which we hear about in skin cancers often. When it's not skin cancer, or when it's not on the actual surface of the body, it's actually much more dangerous. And then also anaplastic large cell lymphoma. So there was significant reports, enough that it became a concern, and they were generally related to more so to textured silicone implants. And since these reports, textured implants are completely off the market in the US. So in outside of the US, in other countries, they're still using textured because things are just done a little differently. The FDA is stringent. If they're going to do something, they'll do it, but they are no longer available in the US, but it doesn't mean that they're not correlated with the other smoother implants. They're just less correlated. So go ahead, Laura.
Agree. And this study is so important because it shows there's so much controversy, capsules removed, capsules not removed. It is now known that all scar capsules can cause cancer. Doesn't mean if they're smooth, silicone. So that right there pretty much debunks the, should we remove the scar capsules? 100% these scar capsules need to be removed. Why would we leave anything in our body that's going to cause cancer, especially when you're already a breast cancer survivor?
And these capsules do not dissolve. So there's
No.
patients that come to us saying their doctor told them, oh, they're just gonna melt away and like you'll have your normal tissue back. And no, they don't. I've went in and taken out capsules that are left alone without an implant on patients that had just the implants removed time and time and time again. And I can always find these little bags that are flattened out, but they're there, and patients, for whatever reason, seem to get better. So it's not so ironic to us that this is a problem.
So
Next
yeah,
slide.
so when the capsules are removed, the patients get better. This is the cancer you were talking about.
So this is that specific cancer, the anaplastic large cell lymphoma, BIA, breast implant associated with textured surfaces. So it was estimated to be somewhere in the 1 to 2,000 to the 1 to 86,000 patient population. So it wasn't very significant, but it was there. And based on the numbers of implants being put in and the fact that you have 2 implants for most women, it was there, the rate for having this seen. Next slide.
Thanks.
So Asia syndrome. So Laura, you want to talk about this?
This is really important. I see down in the corner, you can actually look up the study. It is one of the most solid, I always say, mic drop moments. This amazing scientist is Cohen Tervart. He spoke at the FDA with us. You can find his speech. It pretty much is a game changer when you see what he has to say about this autoimmune inflammatory syndrome induced by adjuvant. What's the adjuvant? The breast implants are the adjuvant. So I highly recommend somebody look, please look up the study and watch what he has to say. It's really eye-opening.
Okay, next, Jeannie. So our overall goals from this lecture here, Laura, and my goals are not to convince you one way or another, but it's to inform you that this can happen. And we generally are not convincing patients that come to us that you're sick. We are there. We want you to be involved in this research to figure out that this may be the diagnosis you're looking for. We're not going to be able to get implants off the market. We wish we could have that much impact, but currently we can at least give information that patients can make the right choice. So we are going after further FDA informed consent rules. Right now, the manufacturers are now starting to sneak a little bit, a sentence or two in their forms that, they tell doctors, have the patient sign these. You may have systemic symptoms, for example, because they don't want to get sued in the back end, but it's just a matter of time. Class actions have been done before. Right now, we're not allowed to based on certain medical devices, which US rules, but it's going to be very interesting as we're pushing and pushing to get more informed consent rules. Next slide. So we are continuing our research. We have a pretty high yield practice. We treat a lot of patients. We work with students from the local med school, and we're trying to build some more credibility around this disease process. So we have some more resources. Our websites are a work in progress, but we are doing what we can. And it's proven to be incredibly difficult without resources that other studies may be able to get. Next. So Laura runs a support group on Facebook. Laura, this is the banner for it.
Mm-hmm. Yep.
Yeah.
If you go on Facebook, BI Centers of Excellence Support Group, it is the one with the white background and blue. That I'm the admin, and it's a private group, and patients just are peeking around the curtain. You can always ask questions, but it's incredible support and information for anybody interested. Next.
Thank you. Hopefully we left enough time for questions, Jeannie.
Great. Oh, thank you so much for this wonderful information. We had a few questions. We have one in the chat that I'd like to share with you first. So she said, you have primarily focused on implants post breast cancer or mastectomy. Would you argue that healthy individuals who have not experienced breast cancer but received implants for cosmetic reasons would all have effects of BII?
Yeah, Danielle, good question. So interestingly, that is the population we're dealing with 90% of the time. It's the patients that receive them for cosmetic reasons, the healthier patients. And what's the reason for that? I think possibly because they potentially are the healthier patients, so they can notice the symptoms, figure out that there's something wrong. All the same symptoms we talked about correlate with the patients that got them for purely cosmetic reasons. Like it's a majority, like 90% literally, that we deal with.
Yeah.
Yeah. And Dr. Sood, you brought up such a great point of, because I am a breast cancer survivor, I had 2 sets of implants. And, I told Laura, I said, I don't think I ever had BII symptoms, but I really don't know, because some of those things could, are similar to what I could have had from some of my hormone blocker medicines, or from menopause, and and I thought that, I got my implants in 2007, right after they had brought back on the market the silicone implants, and they were actually on back order. So I did saline, but and I didn't even think that BII was a thing. And when I first talked to Laura, I'm like, yeah, I never heard those words until 2022 when I had a leak. And my plastic surgeon luckily mentioned breast implant illness to me. And when I researched it, I decided, I'm just taking them out. But anyways, it was a thing. I see, Laura, from 1990. So a
Yeah,
couple
it's
other questions. Oh,
sure.
go ahead, Dr. Sue.
I was going to mention the thing with the hormonal changes as menopause and things like that. There are some of the symptoms that are on our list that correlate, with menopause. So it does make it tricky sometimes, and that's why we can never tell anybody 100% we're going to fix all your problems. There's also comorbid conditions. People come in with arthritis history in their family, some autoimmune issues. But what we've seen in those patients is once the source is removed properly, they improve to an extent. So that means there is some extra weight put on some of these conditions that happen to be there prior to getting implants.
Great point.
Cheryl, yes, the slides will actually be included when we will put the recording on our website, and we can put a copy of the slides as well there, so they will be shared. And we had a couple questions come in via email too. One person had asked, do we know if radiation while having implants can be more harmful to the body, or is there something I should be more watchful for because of this? For instance, can radiation stay in a radiated implant? And what is the shelf life of a radiated implant opposed to a non-radiated implant?
A lot of questions there. So
yeah.
The true answer is we don't know 100%, but what I will tell you is radiation will destroy tissues, decrease vascularity of tissues. It will destroy the implant faster, and it's due to the fact that the scar tissue, which the radiation really affects directly, will start tightening and get tightening and tightening, and eventually get harder. It'll tighten all the tissues. My science brain is telling me that the radiation is potentially going to decrease your BII symptoms. And I know it sounds very odd. It's kind of the opposite of what we're going to go in at here. And let me clarify though. The radiation is decreasing the vascularity and it's increasing the thickness of the scar tissue. So technically, you're actually more protected from that device that's suffocating in that scar tissue. So hopefully, that's my thoughts on a lot of these things. I don't know if we'll ever be able to really study that, but radiation is terrible overall for the body. But in general, I think it may actually have a protective effect on the negative device.
So to add to that, when you had just talked about the capsule squeezing the implant, we can touch base on that just for 1 second. When the capsule squeezes the implant, a lot of times we see a fold when we take that capsule off, and that's where the silent ruptures are. It is like taking a hanger and bending it back and forth, back and forth. So kind of like twofold, a little bit what Dr. Sood is saying, well, that capsule, as much as it is your friend and protecting, it's actually causing a fold in the implant. And that's where we see silent ruptures, if that makes sense.
Yeah, great. And I think this question regarding is there any new regulations now requiring, did we answer that question when you were?
Kind of. I mean, so essentially, there's some regulations, but they're very loose currently, and it's almost like initial here and let's go back to surgery.
Yeah.
Yeah. And this person had emailed mentioning that she had saline implants like 16 years ago, and she was told that they were a lifetime, that they would last a lifetime. And she started having symptoms and was referred to a rheumatologist, saying that she had RA, rheumatoid arthritis, and then was on a waiting list for 3 months. And then because of a RA support group, discovered someone in there had mentioned about breast implant illness and had kind of had a light bulb reaction that, oh, this could be my implants, and had to go to another state to get an en bloc surgery, and felt better right away. So she just said, as she talks to others, she's starting to see women being made more aware of breast implant illness and better informed, and just wondered then if there were any better regulations about mentioning it.
I wish doctors would never say lifetime devices. There's no such thing as an internal lifetime device. So maybe it can withstand the test of time, like for some people, 20, 30 years. We've even seen 40-year-old implants that are structurally kind of still intact. It doesn't mean they don't attribute to a lot of the problems we see, because we say time and time again, it's not a broken device that causes problems. It's a device in and of itself. So when doctors say, oh, like, the water bag, the bag of water can not break for 30 years. It's a device that can last a really long time. Yeah, technically it can, but doesn't mean it's going to be safe for you for all this time. And if it does break at any point along that way, it's catastrophic. Imagine that water rushed into your system. Some people can deal with it. Some people, it puts them off the edge.
It's toxic overload. To touch on regulation real quick. So in 2019, 80 of us went to the FDA and asked for an informed consent checklist. Textured it off to be taken off the market. The FDA dragged their feet to having an informed consent checklist. The issue is, a year and a half later, they did grant our wishes, except they made it mandatory, not law. So to this day, plastic surgeons do not need to give the informed consent checklist because it's mandatory, not law. So that's a really important to mention. If it was law, they wouldn't be able to buy breast implants until they gave that consent form, so women were informed before. So there's that gray area of mandatory. It's not law.
But interestingly, the manufacturers actually took more note of that than the doctors did. So the manufacturers in their paperwork put in a little something. The doctors can still gloss over it if they'd like to. So that's really the truth here.
Yep.
Wow. Very sad. Any other last minute questions? We are a little bit over time here, but man, this was such great information, and I really, really appreciate your the way that you approached it as far as being informative. And I know Laura and I had talked about this, and we were both on board with, it's not about scaring people. It's about being educated and making that informed decision. And if you do choose implants, knowing what symptoms to look for. And so thank you. And wow, that the two of you are such amazing people and have such true compassion and caring for everybody. I really admire you for the work that you do.
Well, thank you. Appreciate
Jenny.
giving us this chance to share this information and bring an informed choice, informed consent to the platform.
I want to answer this one last question because I don't want to leave somebody hanging. They
I
said,
saw it too. Go ahead.
have we found certain brand of implants are more dangerous? No. So they're all relatively similar as far as like the symptoms from these toxic elements. There have been in the past correlations with certain implants showing more contracture rate, more cancer rate, but that's only because that was studied specifically for those. But as far as BII, it doesn't discriminate based on the type of shell or type of implant currently.
Very good.
Thank you. And I just have a couple last minute announcements for our next month's webinar on November 15th is the Healing Power of Connection with Dr. Tom Lenz. And then in December, we're going to look at alcohol's cancer connection and how to raise your glass without risk. So that'll be Saturday, December 13th. And then our upcoming classes that we still have room if you're interested in. We have a navigating brain fog class starting November 3rd, and it is a 6-week free class free to survivors and caregivers. It offered over Zoom. And our Survivorship 101, we have an under 45 class starting on November 4th, and that is a free 9-week class. So for those of you that are new here, we offer Survivorship 101, which is a 9-week class, again, free to caregivers and survivors. So we offer it for all ages, and then we do it under 45 for same curriculum, just sometimes different issues are brought to the forefront because the younger survivors have are in different places in their lives. And then the navigating brain fog class that is also free. So thank you all for joining us. Again, Dr. Sood and Laura, I cannot thank you both enough for sharing your expertise and for the work that you do. Very much appreciated. And I thank you, everyone, taking time out of
Thank
your
you.
Saturday to join us. And have a wonderful weekend, everybody. I will stop the recording.
Thank you so much.